This is the study that's caused all these sensationalist headlines about breast cancer and HRT. It was actually a massive study, and they involved 160,000 women. Women who were started on HRT were women in their 60s, some of them in their 70s, who were obese and who had already heart disease and other medical problems. They weren't women who were going to start HRT at the right time, which is around the late 40s, 50s. What this study has shown that if you use combined oral HRT, which was CEU or Premarin, and progestogen, it's shown that there were 3 extra breast cancers per 1,000 women that were using the HRT over 5 years or longer. There were quite a lot of benefit. There were less overall cancers, there were less fractures, and actually women in this study died less likely than the women who were never on HRT, and they had less diabetes. Now, a few women in the studies were only on estrogen. And so if you took estrogen only, your risk of breast cancer actually decreased. So your risk didn't increase. It was actually lower than if you had combined HRT. And the same was actually prevalent when it came to other cancers as well as death from any other causes. Women who take HRT actually live longer, die less often. But it was this breast cancer that was the only thing that was reported. It was HRT causes breast cancer. They didn't say by how much or what the increase was. It was just HRT causes breast cancer. And everyone stopped the HRT. They didn't even say anything that if you took estrogen only HRT, that it actually decreased the risk of your breast cancer. They didn't say that. It was just HRT causes breast cancer. Not some HRT causes breast cancer, but all of them. They didn't actually even look at what this increase meant. If you are obese, which means BMI over 30, you have 24 additional breast cancer per 1,000 women. If you drink alcohol 2 units or more per day, your risk increases by 5 on average. But here, if you take an estrogen only HRT, your risk dropped by those 4 women. They just said HRT causes breast cancer.